It is time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Morning, Chris.
Your first highlight this morning sounds like an encouraging bit of news for people struggling with a certain form of heart disease. What are the details?
Yeah, this is about heart failure. There's a team at Rutgers University that's reporting some encouraging results from their studies for a novel treatment for heart failure. Typically, patients with this condition, particularly the advanced types, are treated with bypass surgery, transplant, or connection to a blood pumping machine.
Can you tell us about how the new treatment approach is different, maybe how it works?
Yeah, this Rutgers team approach involves re-engineering human heart cells, taking them and then re-engineering them into heart muscle cells. Though they're still far off, the researchers' ultimate goal is to be able to remove small amounts of a patient's native heart tissue, use their engineering process to convert the tissue into cardiac muscles that will work cohesively, and then reintroduce them into the patient's heart, allowing it to heal itself.
Doctor, one interest we all seem to share is a desire to age well. We have long accepted that diet and exercise do play key roles in our ability to do that. But you're suggesting that there is one specific type of exercise that might be particularly beneficial?
Yeah, exactly. The conclusion of a new research study published in the European Heart Journal talks mostly about aerobic exercise. After putting a group of middle-aged men and women through different types and different intensities of exercise, they found that the aerobic activities like jogging and interval training can make our cells biologically younger. So resistance training that we've talked about before, like weightlifting, certainly is beneficial for cardiac benefits, but it was not found to be as effective from an anti-aging standpoint as aerobic exercises.
And finally, what's a person to do when surrounded by, this is hard this time of year, you got Christmas cookies, you got fudge, you got all kinds of things around the house. Isn't adding a few pounds from holiday treats really kind of inevitable this time of year?
Man, it sure seems like it.
Yes, it does.
Every office party, everywhere you go, there are trays of goodies in the break room. Our friends and neighbors bring stuff over. People are caroling. There's tins of popcorn. There's popular loaves of fruitcake. It's just everywhere. But there are some simple steps we can take to keep our weight gains in check.
So what can or what should we do, and are these ideas Grinch approved?
Yeah, no one is suggesting the Grinch needs to lock away all of our goodies, just that we need to be mindful, and this can go a long way. The University of Birmingham researchers say that tracking our weight regularly, such as daily, and pausing to think about the extra calories in that extra holiday cookie or cup of eggnog can help us through the holiday season without packing on too many pounds. They say if we consider it would require us to go on a 20-minute run to work off the calories in a piece of pie, we'd probably make more healthful holiday food choices.
Dr. Bramwell, thank you for your time this morning on KBOI.
Thanks, Chris. Thanks, Rick.
Take care.